Good afternoon, staff, families, and board members, and friends of the New England Center for Children. Today is Tuesday, May 19th. This is my 11th message to the New England Center for Children community during the coronavirus crisis. Yesterday, Governor Baker of Massachusetts announced the first phase of his administration's four-step plan to reopen the economy. Phase 1 does not have any impact on our students returning to school. Staff working from home should continue to do so as we work on our plan to safely reopen our main facility. As we start to settle into our new normal, I urge everyone to remain vigilant and to continue to practice social distancing, wear a mask, wash your hands, sanitize frequently touched surfaces, and stay at home as much as possible. The virus has not gone away, and your continued attentiveness is needed to slow the spread and keep our students safe as you have done so well these last few months. The crisis has far exceeded our expectations in terms of duration and impact on the New England Center for Children. Internally, we're continuing to evaluate ways to reopen safely, and we'll reopen both our main facility and day services when it is safe to do so. We have also been having initial discussions about how to facilitate family visits for our residential students. Please give us some time to set this up safely. We intend to do it. It's more complicated than you might think, so please be patient, but we are working on it. Our main priority continues to be limiting the spread of the virus among our staff and students. Currently, we have 12 students and 11 staff that are positive for the coronavirus. All of them continue to do very well. We expect all students who've been placed in our COVID unit at the school to return to their residence by the end of this week. We expect most of the staff to return to work at the end of this week or early next week, and we should be at full strength if there's no further spread of the virus. All students who have tested positive since the start of the crisis have experienced very minimal symptoms thus far. Now, these numbers and circumstances can change at any time, maybe 5 minutes after I record this video. I would again like to thank our nursing department and our direct care teaching staff for their continued hard work and dedication during this very difficult period. They've been working on the front lines of this pandemic, and I am very grateful to all of them. Going forward, I'll update the NECC community every other week or more if needed. I want to thank all the members of Team NECC for their continued support, and I hope everyone has a safe, hand-washing, mask-wearing, and socially distant Memorial Day weekend. Thank you so much for all you've done to help us move through this crisis.